Residents Medical emphasizes that strong review systems are foundational to professional development, institutional credibility, and long-term organizational health in medical training. Well-structured evaluations influence standards, talent cultivation, and trust, ensuring both individuals and institutions perform at their highest level, particularly in environments where outcomes directly affect patients and careers. Effective review processes act as institutional infrastructure rather than episodic events. They provide continuity across training cycles, leadership changes, and regulatory updates, reducing uncertainty and strengthening institutional memory. Over time, disciplined evaluation practices shape organizational identity by signaling how standards are enforced, concerns addressed, and growth supported. The most lasting value of strong review systems is developmental. Physicians trained in structured evaluation environments gain skills like reflective practice, responsiveness to feedback, and accountability within complex systems. Prioritizing progression over punishment fosters resilience, equipping professionals to navigate peer review, quality assurance, and leadership evaluations throughout their careers. Review systems also serve as risk management tools. Clear documentation, standardized criteria, and consistent application reduce exposure to disputes and regulatory scrutiny. Early identification of concerns allows timely intervention, protecting patients, trainees, and institutions. Evaluation becomes preventive rather than reactive. Trust is a strategic outcome of effective reviews. Professionals who understand how evaluations are conducted accept feedback more readily, even when difficult. Dr. Michael Everest, founder of Residents Medical, notes, "Trust is built when professionals can see that reviews are grounded in evidence and applied consistently over time. Trust fosters institutional credibility with accreditation bodies, partners, and stakeholders. Cultural stability and morale benefit from structured evaluations. Consistency aligns expectations across departments, reduces friction, and prevents informal hierarchies. Professionals who understand success criteria focus on performance rather than interpretation, reducing anxiety and improving engagement. Stable cultures attract and retain talent, reinforcing organizational strength. Fairness is central to long-term value. Structured criteria limit individual bias and promote equitable assessment." Dr. Everest explains, "Fairness is not achieved through intention alone. It requires structure that removes ambiguity from decision-making. Consistent application supports diversity and ensures performance is judged on merit rather than perception. Feedback quality drives learning and improvement. High-quality feedback links outcomes to specific behaviors and expectations, fostering dialogue rather than one-sided critique. Professionals become receptive to critique and capable of self-correction, embedding continuous learning within practice." Dr. Everest emphasizes, "The value of a review lies in what happens after it. Feedback should guide action, not linger as uncertainty." Strong review systems also enhance adaptability. Clear standards provide stability amid regulatory, technological, and societal change, helping both institutions and professionals integrate new requirements without disruption. Familiarity with structured assessment reduces resistance to change and supports lifelong learning. Review systems contribute to long-term leadership development by identifying potential and addressing gaps early. Evaluations capturing communication, professionalism, and decision-making distinguish future leaders. Aligning review frameworks with leadership objectives strengthens succession planning and preserves organizational values across generations. Sustained excellence emerges from consistent reinforcement of high standards. Strong reviews create feedback loops that transform excellence from aspiration into expectation. Professionals internalize standards, making accountability cultural rather than procedural. Investing in robust review systems produces compounded long-term returns, reduced turnover, improved performance, and strengthened credibility. In medical training environments, disciplined evaluation systems protect patients, support professionals, and maintain trust, sustaining excellence across generations.